All right, what's up everybody? We're back with the Pso-Rite, doing some Pso-Rite work, daily Pso-Rite work, and today we're gonna get into this big chunk of your thigh, all right on the outside here, bam, bam. We're gonna go up and down, and what we're gonna do with the Pso-Rite is we're gonna turn it left and right, left and right, left and right, and we're gonna really simulate that hand going up the thigh, pushing into it, and working your way into that muscle, or when you get that massage, it's an elbow, right? Pushes into it, slides down it. And so we're gonna just push into it and then move, right? So it's a push, push, and then move. Push, push, and then move. So when I was training for the Pan Ams a long time ago, just as a white belt, I had a black belt instructor, and our strategy going into it was pull, pull, and then you shoot. So when you do this, push, push, and move. You got to do it with an accent. Push, push, and then move. Push, push, and then move. Or do whatever you want, I don't care. But make it fun. Anyways, this will feel a little dicey. You're just moving up and down and just trying to, you can get into the bottom, the back side of your leg a little bit. You can, in this position, turn it all the way, and I can push right into it. Push right into it. I'm just using my body weight. So if this is too much, then I just back off. And so the pain threshold that I'm trying to get to on a scale 1 to 10 is a 5. So I'm trying to find that 5 spot. And outside here, this side right here has a lot of like very tender areas because it doesn't get a lot of range of motion. And when we go here, it's flexed. And we go here, I mean, it doesn't even feel like it gets stretched, really. So, I mean, you got to do some different things to like try to even get even remotely into it, and you still don't even feel it. You feel it down in your butt, or you feel it somewhere else in the top part of your leg. So this area doesn't get a whole lot of love, but it gets a lot of tension buildup. So by just sitting down on the ground and just pushing into it, and I'm just moving around, just kind of finding those little crevices that might be feeling super tender. And so look at, I'm also gonna do this where I'm not even gonna be on the Pso-Rite, but I'm gonna push into it with the outside of my arm here. So I'm gonna push in right here, lift it up, and I'm just gonna push in. I'm getting right up in this top part, right up in here. Just push, push, and move. Push, push, so it's 2 pushes, and then move. And so now this is more of like an active, you know, kind of like a muscle activation technique kind of approach in a sense, but I'm just pushing the muscle and then I move. I push in the muscle and I move. I push in the muscle and I move. Muscle activation technique is more technical and it does some amazing things, but this is just more just pushing right into that side of that thigh muscle there. So now you can just find a spot and just hang out. Set a timer, do some acupressure, and just hang out. Stay here. What I've gotten from a lot of my acupuncturists is, or my other acupuncturists, is to do, you know, an effective acupressure. Stay on it for about 3 minutes. You know, so set it and find that pain threshold. So I'm pushing into it. I'm not pushing it to the point where my face gets all, I can't breathe. My face gets crazy. I start speaking tongues. No, I find that threshold about 5, and then I just stay right there. I'll just hang out here, watch a video, read a book, do something, text your friends, and then move it. And I'm just moving around here, and you'll find areas like right here, I'm pushing into it, and I can't even get even a 3, because I've been doing this for even just recently. I went and played volleyball today, and I just pushed in. My quads are feeling really tight from playing beach volleyball, and now I'm just pushing into it, and I can't even find even a 3 in this position, so then I'm gonna move it. Can't even find a 3 there. And then now once I start getting down a little bit here, there we go. Now I found that sticky spot, boom, stay right there. I'm just gonna push into it a little bit, breathing, big breath in. So the breath in, remember it's gonna be, the exhale needs to be twice as long. So if you take a small breath, it needs to be twice as long as a small breath. Take a really big breath in, you gotta slowly let that out. And so you can play around with how many seconds it's gonna take for you to even breathe in, you know. I always say more breath the better, but so all it is, moving the Pso-Rite, doing that clockwork. So this would be 12. That would be what, 1 and 7 o'clock, Move that, that's 2, 2 and 8 o'clock. Move that, that's 3 and 9, right? So boom, boom, just clockwork. So I'm just moving around, really getting way up there. And like I said too, get into that back side of your leg too. It comes at it from a different angle. Push right into it, you might get into that, what's called the IT band. Push into that a little bit, move right down that little seam so you can see the seam right here. Bam. Right there, just go up and down that, just right there. Push in. Remember, go at your own tension, not tension, your own pressure. Push into it more or push into it less, and then just gauge that, and then just keep doing it. Stay consistent. Consistent is key in getting tools that you don't have to work too hard with. There's a lot of awesome tools out there. Sometimes I use some other tools, but I've been really using this one. In all honesty, I've been really using this one. Yes, it's my product, but using this one a lot because I can get into so many different areas of it really easy without having to add in extra props. And now I can get into the calves and all that stuff. So there'll be other videos, get into the calf area, the quad leg here, mess around, check it out. There's gonna be tons of videos, specific videos for just the muscles, specific videos for test, retest, for particular movement. Check it out. Thanks for watching. Comment, questions, all that stuff is definitely welcome. See you next time.